Welcome back, everybody, and it is a historic day here in the United States. The coronavirus vaccine has officially arrived, and some are actually getting the shot itself. But with the arrival of this vaccine also comes a whole lot of questions. So this afternoon, we'll turn it over to Dr. Erika Hamilton, a microbiologist from UMass Amherst, been with us really since the start of this pandemic. And also, we've been talking about this vaccine. So we're here, Dr. Hamilton. And I guess the first question is, once I get a COVID-19 vaccine, do I still have to wear a mask?
Most likely, yes, you'll have to wear a mask at least for a little while. We can't vaccinate everybody all at the exact same moment, and it's going to take a little bit of time to get everybody done. And remember, the vaccine has about a 95% efficacy or how well it works rating. So you have a 95% chance of it working very well for you, but you also have that 5% chance that it won't work. So of everybody, if you have 100 people who get the vaccine, perhaps as many as 4 or 5, it may not work that well for them. So it's not 100% foolproof. No vaccine is. And until we get more and more and more people vaccinated, there will be a danger that you could either catch the virus and spread it or catch it from somebody else. So yes, for a little while longer, until we get enough people vaccinated, we will be wearing masks, social distancing, and washing our hands.
Very interesting stuff then. So keep up what we've been learning here for just a little bit longer. And to piggyback off this, how long do you think then it will take to reach herd immunity once this vaccine is given to the general public, let's say by next spring or so when everybody's starting to get it?
Herd immunity for COVID-19 should be around 70% of the population. There are some estimates that it might be a little bit lower, but we'll go with the 70% for now. So in other words, 70% of the population has to be immune from the virus either through a vaccine or by having had it before we're able to stop doing all the precautions that we're doing. And this is a key point because a lot of people are saying, I'm not getting it, I'm not going to be a guinea pig. You know, they're very worried about the vaccine. If enough people don't get the vaccine, we're not going to be able to lift all of the restrictions and precautions we're doing. And we're going to be stuck in this time when we're going to have limited people in stores, limited people in restaurants. We're all still going to be wearing masks, social distancing, and having problems with school children being able to learn. So the more people who get the vaccine, the faster we will be able to go back to a pre-COVID level of functioning.
Yeah, that's very interesting there and puts it in perspective. Like, that's life. All right, so here we are. Is it possible that the virus mutates and the vaccine is no longer effective? We got like a minute or so left.
The chances of this happening are relatively low. People are looking at COVID to see, does it change easily like the flu virus does or the common cold does? And it doesn't seem to from what they've looked at with other close relatives like SARS and MERS. But one of the things that scientists will be doing is they're going to be monitoring COVID infections all around the world for years to come. And they're going to be specifically looking for new strains of COVID that appear. And if that happens, a vaccine will have to be made for that. And then we can do a mixed vaccine for different strains if new ones appear.
Very good. And fascinating insight, as always. Dr. Erika Hamilton, truly do appreciate you coming on here today on this momentous and historic day. So no doubt we'll be catching up with you here in the coming days as vaccine questions no doubt linger. Be well, all right?